going to stop the stream. We're just going to keep going. Let me switch sides, and I'm going to bring in, what's wrong? He's got it. We're going to bring the fluoro in so that I can localize to the facets we need to treat. Any questions?
Yes, we have a question from Ross
Pressure here.
on YouTube.
Mm-hmm.
Does the disc regrow itself with scar tissue? And can the injury reoccur since the scar tissue is not strong enough?
Ross, great question. Great question. So the disc will definitely regrow, and it regrows with collagen and elastin. So remember, scar tissue is made from collagen, and the disc itself is made from collagen and elastin. So it turns out that the annular tear will repair itself with its own material, collagen and elastin. All right, let's take a look at what we got. We're doing 7, 8, 8, 9, 9, 10. There's 12, 11, 10, 9, 8, 7. So we're dead center, right where we need to be. Go ahead. Let me see. Yeah, I think right about there. Jordan, can you give me better visualization? I need to see the transverse processes. I think I see that one. I see that one. I see them. I think we're okay. So we're going to target the facet. Bring the camera higher. All right. Shot. Very nice. All right. If you have questions, feel free to ask. Shot. All right, I'm at the bottom of that transverse process. I need to go to the top. Shot. All right. Let's show the audience, Anthony, how facet joint pain occurs and how we treat it.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. We're right on the spot where we're trying to destroy the pain nerve for the facet joint. Did you show them how to cure thoracic facetogenic pain, Sean?
Facet joint injury is a common cause of chronic thoracic back pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
We're just finishing up, Sean. That's perfect. All right. stapler. That's one side down. You want me to put medicine? We're going to get the other side next. So we just treated her facet joints, and that's where she was having her thoracic pain. We did the right side. Next we're going to do her, we did her left side. Next we're going to do her right side. Any questions? Did you show the video on how thoracic facets get fixed with our Deuk plasma rhizotomy?
Yes, I have.
Sean? Okay, show me that side better, Jordan. I'm going to have my x-ray technician, Jordan, localize that side a little bit better so I can see the transverse processes better. Let's see. I think right there, Luis, is good. We're going to make a small incision, and then I'm going to, a little bit bigger than that. Then I'm going to target. Yep, that's perfect. And then I'm going to target these transverse processes. All right. So, how is she doing, Dr. Berndes? Shot. All right, let's go north just a little bit. Shot. Shot. So the first thing I have to do is line my tip up of my probe with the actual target, which is right where the transverse process meets the superior articular process. Shot. Right about there. And the reason why it looks weird is what we call parallax. Right, Jordan? Parallax is when you shot. Too lateral. When you, hold on, shot. When you have a x-ray that you have a point source of radiation and it basically misses or goes through the target but at an angle. So you don't get a direct through. So you don't see a projection the way you expect it to in a textbook, but it's sort of oblique and off a bit. So you have to account for parallax. Shot. All right. Shot. Hold on. Shot. All right. Where do you see it? It's right. My tip's right there, huh? Just a little bit lateral. I can feel it. Shot. Yeah. I can actually feel the nerve, the pain nerve. Shot. She's got some arthritis here. A lot of arthritis, actually. All right. And then going to keep going. We got a few more to go. Shot, but she's doing great. That's too medial. Shot. That's the TP. Need to be a little more superior, a little bit more medial. That's right in the area where she has pain. So hopefully that gets it. Shot. It's too lateral. I want to be just a little bit more medial. All right. Let's go again. Any questions? Sean?
Yes, we have a question from Saul on YouTube.
Saul. All right, welcome, Saul. Go ahead.
Is this procedure safe for a patient with mild thrombocytopenia?
Yeah, it sure is. So thrombocytopenia, for those of you who don't know, means there's too many too few platelets. I apologize, too few platelets. Platelets are tiny fragments of cells that travel through the bloodstream. I think we're done. And they're involved in forming the platelet plug. Anytime you have a trauma to a blood vessel, the first thing that happens is the underlying tunica media adventitia are exposed once you get a tear in the endothelium, and the platelets see that exposed adventitia and they bind to it and try to stop the hemorrhaging or bleeding. So somebody with thrombocytopenia has a low platelet count, and they're more prone to bleeding longer. They have a longer bleeding time because they basically cannot form the platelet plug right away as well as somebody who has normal platelet count. But generally we need the platelet count above 100,000. 100,000 or higher for elective surgery, which I'm sure yours would be. So as long as your platelet count